Dr. James Hartley, a seasoned general practitioner, had always prided himself on delivering compassionate care to his patients. However, as the date for his annual medical appraisal approached, a sense of unease settled in. The appraisal, a process designed to ensure ongoing competence and identify areas for improvement, had become a source of anxiety. Dr. Hartley knew that the quality of his supporting information would play a crucial role in determining the outcome, yet he found himself grappling with the challenges of gathering and presenting this information effectively.
Every year, this appraisal process seems to creep up on me, and every year it feels like I'm never fully prepared. There's just so much to document and collect, from CPD activities to feedback from patients and colleagues, and honestly, it's stressful.
Dr. Hartley had participated in numerous continuing professional development (CPD) activities over the past year. These ranged from attending formal workshops on the latest medical advancements to self-directed learning through journal reading. However, as he sat down to compile his CPD documentation, he was confronted with the complexity of the task. The sheer variety of CPD activities, coupled with the lack of standardized documentation methods, left him questioning whether he had captured the full extent of his learning.
I've done workshops, attended seminars, and even done some self-study. But the problem is, there's no standard way to document all this. It's all over the place. And how do I prove that these activities really made me better at my job? That's what worries me.
Moreover, Dr. Hartley was acutely aware of the need to demonstrate the quality and relevance of his CPD activities. It wasn't enough to show that he had participated. He had to prove that these activities had genuinely enhanced his skills and knowledge. This was particularly challenging given the time constraints he faced. Balancing his demanding clinical duties with CPD requirements often meant that his engagement with these activities was rushed.
Sometimes I feel like I'm just checking boxes to meet the requirements, but is that really helping me improve? I'm not so sure.
Dr. Hartley had also been involved in several quality improvement (QI) projects, aimed at enhancing patient care within his practice. However, when it came time to select which QI activities to highlight in his appraisal, he was at a loss. Not all of the projects he had worked on were equally impactful, and he struggled to determine which ones would best represent his contributions to improving healthcare delivery.
Not all QI projects have the same impact. I've worked on a few that made a big difference, but others, well, it's hard to measure the outcome. And how do I show that my contributions really mattered? That's tough to quantify.
Even more daunting was the task of measuring the impact of these QI activities. The outcomes were often complex and multifaceted, making it difficult to quantify the improvements in patient care or system efficiency. Dr. Hartley feared that the lack of robust metrics would undermine the significance of his efforts in the eyes of the appraisers.
I wish there was a straightforward way to show the improvements we've made, but it's not that simple. And when it's a team effort, how do I separate my role from everyone else's?
A few months prior, Dr. Hartley had received a complaint from a patient who was unhappy with the wait time for an appointment. Although the complaint had been resolved amicably, it had left a lingering sense of dread. He knew that this complaint would need to be included in his appraisal, and he worried about the potential impact it could have on his overall evaluation.
That complaint, it still weighs on me. I know it's just one incident, but it's hard not to let it overshadow everything else. And how do I make sure the appraisers understand the full context? It wasn't all my fault, but it's still on me.
The complaint had been a reminder of the emotional and professional toll that such incidents could take. Dr. Hartley was concerned that the inclusion of this complaint, regardless of its resolution, might cast a shadow over his appraisal. He also grappled with the challenge of ensuring that the complaint was presented with the appropriate context. After all, not all complaints were justified or reflective of his overall performance. On the flip side, Dr. Hartley had received numerous compliments from patients over the years, thanking him for his compassionate care and dedication. However, these expressions of gratitude were often informal and undocumented, making them difficult to include in his appraisal. He realized that the lack of systematic documentation of compliments could result in an incomplete picture of his positive impact.
I love hearing that my patients appreciate what I do, but those compliments don't always make it into my records. They're usually just quick comments after a consultation, nothing formal. How do I make sure they count?
Dr. Hartley also recognized the inherent subjectivity in compliments. He knew that patients' expressions of appreciation could be influenced by personal affinity or specific positive experiences, which might not necessarily reflect his overall performance. This made him wary of overemphasizing these compliments in his appraisal.
And even when they do make it into my file, I know that compliments can be subjective. How do I balance those against the complaints? It's a tricky line to walk.
When it came to gathering feedback from colleagues, Dr. Hartley faced yet another set of challenges. Response rates were low, with many of his peers too busy to provide comprehensive feedback. Those who did respond often provided vague or overly positive assessments, likely influenced by their desire to maintain good working relationships.
Getting feedback from my peers is like pulling teeth sometimes, and when I do get it, it's often too positive or too vague. I know people don't want to hurt feelings, but I need honest feedback to improve.
Dr. Hartley was also concerned about the potential for bias in this feedback. He knew that workplace dynamics could skew the responses, and he worried that the feedback might not be an accurate reflection of his performance. The challenge of ensuring objectivity and maintaining confidentiality in the feedback process weighed heavily on his mind.
Patient feedback is valuable, but it's not always clear what I should take away from it. Sometimes the comments are too general, other times they're very specific. But what do they really mean in the context of my overall performance?
As the appraisal date drew nearer, Dr. Hartley decided to take proactive steps to address the challenges he faced. He began by attending a workshop on best practices for appraisal documentation, which provided him with valuable guidance on how to standardize his CPD and QI documentation. He also made use of a new online platform designed to streamline the collection of colleague and patient feedback, ensuring that the process was both efficient and confidential.
I decided to get proactive. I went to a workshop, learned how to better document my activities, and started using an online platform to gather feedback more efficiently. It's made a huge difference.
Dr. Hartley also reached out to his peers for advice on how to balance the inclusion of complaints and compliments in his appraisal. Through these discussions, he gained a better understanding of how to present this information in a fair and balanced manner. Finally, Dr. Hartley committed to regularly reviewing and updating his supporting information throughout the year, rather than waiting until the appraisal was imminent. This approach allowed him to keep track of his activities and achievements in real time, reducing the stress and workload associated with preparing for the appraisal.
I'm trying to keep on top of things now, instead of leaving it all to the last minute. It's less stressful, and I feel like I'm more prepared.
When the day of the appraisal finally arrived, Dr. Hartley felt more confident than he had in previous years. He presented his supporting information with clarity and conviction, demonstrating the breadth and depth of his professional development. The appraisers acknowledged the challenges he had faced, but they were impressed by his proactive approach to overcoming them.
I felt good going into the appraisal this year. I knew I'd done everything I could to present a fair and accurate picture of my work, and the appraisers noticed. If there's one thing I've learned, it's that you can't do this alone. Use the resources available, talk to your peers, and don't be afraid to ask for help. It's a tough process, but it's worth it.
Dr. Hartley's experience serves as a reminder of the challenges and pitfalls inherent in collecting supporting information for medical appraisal. However, his story also highlights the importance of perseverance, proactive planning, and the use of available resources to navigate these challenges. For healthcare professionals facing similar difficulties, Dr. Hartley's journey offers valuable lessons on how to turn a daunting process into an opportunity for meaningful professional growth. Like, share, and subscribe to the Medical Appraisals YouTube channel for valuable insights on appraisals, revalidation, and trending topics relating to healthcare and life sciences.